Okay, good morning, everybody. We will be continuing with our head nurse lecture discussion. May I call on our next speaker? It is Mr. Ayan, we have here Mr. Manuel Rafter, and he will be discussing to you about your GCS scoring. This is very important because we have a lot of questions for your GCS scoring. So, okay, I think you're ready, Mr. Rafter. Okay
Yes
na?
po, ma'am. Yes po.
Sige.
All right. Once
Then we
again,
can
good
have
morning, everyone. Yes, good morning, everyone. I hope you are tuned in with us. And yes, I believe that this is the fifth topic for today. At kaya pa ba ninyo? All right. Yes, keep them coming, head nurses. All right. Okay. So, yes, kakayanin po ninyo ito. Kaya nyo nga magstay sa maling tao eh. Okay, anyway, let me go on to the lecture proper this morning. Once again, my name is Rafter Manuel, and the topic at hand is about neurologic assessment. And the focus of our lecture this morning would be pertaining to the Glasgow Coma Scale, or yung tinatawag natin na GCS. Now, we all know, folks, that the neurological history and proper examination will allow nurses and even healthcare practitioners, or perhaps the physician, okay, to pinpoint various area of our brain or our nervous system that may be dysfunctional. You see, 47 years ago, two neurosurgeons by the name of Brian Jeanette and Graham Teasdale pioneered, or they developed the GCS, or the Glasgow Coma Scale, in which it is widely accepted today. It is widely applied today in so many healthcare facilities. All right. The GCS was initially used to really assess the LOC na tinatawag natin, or the loss or level of consciousness rather, in patients after head injury. But the scale is now being used to many acute unwell patients today. In the hospital, you would see healthcare workers would use this scale inside the emergency room, inside the ICU. Okay, I would like to share to you what Jarvis said. Jarvis of 2011, he said, using the scale consistently in the setting allows healthcare providers to share a common language and monitor for trends across time. Anong ibig sabihin nito? GCS provides a standardized approach to really assess, or assessing rather, and documenting a person's level of consciousness. So everybody, wherever you are, no matter where you work, what you were doing, everybody could be on the same page and really talking the same language in order to describe the level of consciousness of a certain patient. And so this truly is a profound, groundbreaking scale that they had come up, the two surgeons, neurosurgeons. And I think it's pretty evident that to the fact that we are still using it today inside the healthcare facility. And one of the reasons why having this GCS scale or GCS scoring and assessing the GCS of our patient is so important. It is because even a slight change in the person's level of consciousness, which essentially is going to have a change in your GCS score, will prompt you as the nurse or even the other members of the healthcare team to formulate specific patient-centered interventions. And as the GCS score of your patient drops, and it will give you the idea, uh, when the GCS score of your patient drops, it will give you the idea, itong pasyenteng ito is manifesting signs of neurological problem. So we need to keep in mind that when you are doing this assessment, you should be aware of the changes and really a possible decline in the score of your patient. And so before I discuss to you the different parts of the GCS, before I give you the breakdown, okay, the criteria of our GCS, I would like to mention an important fact to for us to really think about the hierarchy of our brain function. Okay, the hierarchy of our brain function to really understand how these different scores really signify a deterioration in our patient's neurologic condition. And there's really three levels of this hierarchy that I want to talk about. Unang-una, let us see the cortex. So the very top, okay, and really the highest level of this is going to be our cortex or yung tinatawag na cortical processing or yung cortical thinking, ika nga. It's the highest level processing that our brain does. You see, in the anatomy and physiology of our system, the cerebral cortex or yung cortex cerebri, it is the outer layer of our brain that has a wrinkled appearance. It is divided into fields with specific functions such as sensation, hearing, smelling, and really controls higher functions such as speech, thinking, and memory. So now, as we kind of go below this high-level processing, we have what we call the subcortical. All right? And this is going to be that mid-level, that more primitive brain that really isn't part of the very high level functioning cortex processing. All right? So these subcortical structures are a group of diverse neural formations deep within the brain. It includes the encephalon, it includes the pituitary gland, the limbic structures, and the basal ganglia. They are involved in complex activities such as memory, emotion, pleasure, and hormone production. And then finally, as we go down again from cortex to subcortical, we go to the lowest, which is the brainstem. This is those real basic low level, almost reflex like responses that our brain has. And so if you think about it, as we make our way down, as we move from those high-level intricate brain functioning processes to the more basic, more primitive, and reflex-like processes, you will see this manifest themselves in things that your patient is doing. And we can quantitatively measure this by using what Brian Jeanette and Graham Tisdale pioneered, which is the GCS or the Glasgow Coma Scale. This is your Glasgow Coma Scale, all right? It is divided into three major brain functions. It assesses three major brain functions. We have the eye opening, we have the verbal response, the motor response. Kung papansinin po ninyo, they have points. All right. Here in the eye opening, the highest point that a patient could get is 4 points. In the verbal response, 5 points. In the motor response, 6 points. As I have mentioned earlier, the GCS rates a patient's level of consciousness according to three components: what their eyes are seeing, that is your eye opening; what they are saying, which is the verbal; and what their muscles can do, which is their motor bit. So each of these components is split into separate criteria. All right, and every words here that you see have a corresponding points. And so a normal response is the highest or best number, and the lowest is no response at all. So the best score that you can achieve is the highest, 15, and the lowest is 3. Wala pong zero na value dito. It would always be 3. All right? Always remember that the lowest that a patient could get when you're assessing, when you're performing a neurologic assessment, is 3, and 15 is the highest. 15 out of 15, the patient is completely fine. It is normal. When the patient's GCS score is 7 or less, they are considered comatose. Patients with a GCS score of 8 or less, they are already considered to have suffered a severe head injury. That is why it is worth noting that a scale score lower than 8 out of 15 in the context of a comprehensive clinical evaluation usually is an indication for intubation. Tandaan po ninyo ito. Remember this. If it's 8, get ready to intubate. If it's 8, if the score, GCS score is 8, get ready to intubate. And so the higher the score, the better. Okay? And so moving on, this is the sum of your GCS score. You will put them, you will add them together. Eye opening, verbal response, and motor response, and that would be your GCS score. How can I remember this? EVM. All right? You can remember this by this one. Every virgin moans. I plus verbal plus motor. EVM. Okay? All right. So let's go to the breakdown of our GCS. Okay, let's go first to the eye opening. As I have said earlier, your scoring for your eye opening is a total of 4 points. Okay? 4 is the highest, 1 is the lowest. So basically what this is doing is this is reflecting the amount of stimulation that is required in order for your patients to open their eyes. All right? Also, it is very important for you to know that this really can be impacted by things such as orbital fractures. If the patient has an eye swelling or swelling around their eyes, or anything really scarring, or anything, or wounds rather, or anything that could really prevent them from actually being able to open their eyes when they otherwise would normally do so. So it's very important to take these factors into consideration. And if you do have limiting factors like what I have mentioned, it is very important for us to document as such. Okay, let's go first to the highest score that we can give to our patient basing on the neurologic assessment is 4 points, or the eye opening spontaneously. You see, if the patient opens his or her eyes spontaneously without even you talking to that patient, without even you giving painful or introducing painful stimuli to your patient, you give him or that patient 4 points, right? Without any stimulation, 4 points. So basically, you walk inside the room of your patient and your patient is lying down, looking around. You came as a nurse and the patient looks at you and there was a spontaneous eye opening, you give him 4 points. Okay, going down to the scoring of the eye opening, we have 3 points for to sound or verbal stimuli. You see, if the patient is let's say sleeping, his or her eyes are closed, but when you talk to that patient, hey, patient Marisol, and patient Marisol would open her eyes, then you give that patient 3 points because he was responding to sound because of that verbal stimuli. Okay? Going down to point number 2, which is to pain. Okay? So for this response, you have talked to your patient rather, you have spoken loudly, loud commanding voice, and still they aren't opening their eyes. But if you apply some sort of painful stimuli, either to their eyebrow, to their trapezius, or if you give the patient a sternal rub, masakit po yun. Or wait, let me just show you my slide. All right. These are the site of physical stimulation. Fingertip pressure, you put pressure in the nails of your patient, that is painful. All right, trapezius pinch, masakit din po ito. Supraorbital notch. All right, so anything that you give to your patient as painful stimuli, and the patient will open his or her eyes, then you give that patient 2 points. Why? Because the patient opened his eyes or her eyes because I introduce a painful stimuli to him or to her. Okay? So we need to take note of the limitation in the eye opening. The patient may have an eye injury. The patient may have swelling around the eyes around his or her eyes. So just take note of the limitation. Now, as we take a look at the scores here in the eye-opening category, hopefully you can kind of see that we work our way down the scale, down the score. Your patient is having less and less neurologic response, especially from the higher level down to the lower level. So if we think about the patient's spontaneous eye opening, that's obviously going to be that very high cortex processing. Your patient is fully awake, your patient is perhaps oriented, your patient is alert. Whereas if we start to have some sort of injury to that high level area, which I mentioned in the hierarchy of our brain, but still functioning within that area, they will open their eyes as a result of processing that language, that verbal stimuli, or that painful stimulation or stimuli that you introduce to your patient. Okay? So if your patient does not respond at all, you give him 1 point for no response. Again, there is no zero value here. The lowest is 1. Okay? The lowest is 1. Sir, tanong, what if the eyes of my patient or the there is swelling around the eyes of my patient? What should I do? Okay? What you can do here is you give that patient the lowest score. What is it? It's not 0, it is 1 point. Okay? And beside that 1 point, you are going to input the letters N and T. N, Nino, T is Tango. 1 point, NT. Anong ibig sabihin ng NT? Not testable. Okay, so this is your eye opening. Mnemonics, please. All right, for our the first element of GCS, the theme of our GCS here is sports. The other mnemonics that I will be presenting later would really is really inclined to sports. ESPN, you all know this. It is a sports channel. ESPN, eye opening spontaneously, 4 points. S, to sound, verbal stimuli. T, to pain, or letter P rather, to pain. And N, no response, 1 point. Okay, so that is our eye opening. Now we move on to the verbal response. Kanina, we only have 4 points for the eye opening. Here in the verbal response, we are going to have 5 points as 5 the highest, 1 again is the lowest. How are we going, sir? How are we going to perform the verbal response as we are going to have this neurologic assessment to my patient? How do you do it? In assessing the verbal response to your patient, you need to engage the patient to a routine conversation. How does a patient gain score? You need to engage your patient to a routine conversation. Now again, let us go to the highest point, which is 5 points. Um, if you allow me, please, I just makati yung lalabunan ko. Pasensya na. I'll just drink. Thank you. 5 is the highest, which means the patient is oriented. All right. The patient who is active in normal conversation can properly receive 5 points on the GCS. So this means that the patient is oriented and can answer to simple questions. So you walk inside your patient's room, you see that your patient is looking around, okay, eyes spontaneously opening, and then you engage your patient to a conversation, a simple conversation by asking simple questions. Sir or ma'am, can you please tell me your name? Yes, my name is Marisol Jumaya. Ma'am, can you please tell me what year is it today? Yes, 2021. So your patient is oriented, right? If your patient is able to appropriately answer those questions, then you give them or you give that person or that patient 5 points. Again, going down, verbal response point number 4 is confused. All right. In the case of a patient who makes proper discussion but is confused and disoriented, perhaps you give him or her 4 points. All right. You try to talk to that patient and the patient is just staring at you, looking around. It seems like he is confused. He doesn't know where he is. He doesn't know what is happening. He doesn't even know what year it is. Then you give him 4 points because your patient is confused. Again, let's go below, all right? Inappropriate words. This is 3 points. Inappropriate words. A patient who is unable to participate in normal conversation is responding randomly or using exclamatory articulated speech, for example. You would ask the patient, "Sir, how are you?" And then the patient you would give you a response that you do not even understand the words that he is using. Inappropriate words. Okay? All right. Going down below. Again, 2 points. Incomprehensible sounds. All right? A patient who cannot participate in a conversation at all, incomprehensible speech, or the patient would be producing sounds without meaningful or without a meaningful content, that patient receives 2 points. So basically, you walk into the patient, you try to engage your patient to a simple, normal conversation, and your patient is just groaning. Your patient is just, moaning, right? They are making this some sort of weird sounds, then you give your patient incomprehensible sound 2 points. Okay, and again, the lowest score is no response, 1 point. Walang zero. Okay, walang zero. The lowest is 1. We need to take note also that intubated patients cannot be assessed, all right, for verbal response kasi nga may tubo. And patients with tracheostomy, all right, just like with the eye opening, if it's not testable, you give the patient 1 point, no response, of course, obviously, and then you put the words empty or not testable. Okay, tapos na tayo sa eye opening. We're done with the verbal response. Now let me give you the mnemonics. All right, elements of GCS, verbal responses. Kanina, ESPN, it is a sports channel. Now, The mnemonic for the second element of GCS is our country win or WIN. Our is oriented, country is confused, W is word inappropriate, I is incomprehensible sounds, and then N is no response. Okay? So moving on to the motor response, I hope that you are still here with me listening kahit medyo boring ako mag-lecture. Um, please like na lang, please like na lang. All right? Okay, let's go to the motor response. Kanina sa eye-opening, we have 4 points. The verbal response, we have 5 points. In the motor response, we have a total of 6 points. Now let's go to the highest point, which is 6 points. If the patient moves his or her hands or her legs spontaneously and are following the command that you have given him or given her, then you give that patient 6 points. For example, you walk inside the room of the patient, and then let's say you are already in the motor response assessment on your GCS scoring. Sir or ma'am, can you please open your mouth and stick out your tongue? If the patient could perform the instruction or the command that you have given him or her, then you give that patient 6 points because they obey your command. Sir, ma'am, can you please lift your left leg? Can you please lift your right leg? Those kind of questions. Because we are assessing the high cortex functioning based on the hierarchy of the brain function. Now, moving down, okay, 5 points for moves to localized pain. In the case of a patient who is attempting to identify and remove the stimulus away is 5 points. Okay, 5 points po ang ibibigay ninyo. This is where your patient is localizing to the pain. And essentially what this means is if you give them some sort of painful stimuli, let's say for example, you would pinch their chest, they are going to move to that source even though they cannot fully, flex their hand to that localized area or the localized pain. They will try to move towards, okay, that painful stimuli and try to and attempt to stop that painful stimuli. So that is point number 5, moves to localized pain, right? Going down again, we have flexion, withdrawal from pain. Kanina, if you're going to pinch the patient in the chest area, if the patient would try to attempt to stop and go to that localized pain, then that is 5 points. However, if the patient would try to withdraw himself or herself away from this painful stimuli, then we give our patient 4 points. That is flexion, withdrawal from pain. You see here, the lower level subcortical is starting to get into some sort of brainstem dysfunction. Okay? So again, it's very important for us to distinguish from withdrawing from pain and localizing to pain, because it definitely signifies a change not only in the score of your patient's GCS, but also the hierarchy of processing that your patient is able to do as a result of whatever is going on with their injury. Okay? Moving below. Sige. Pasensya na po, Ma'am Marisol, if I exceeded the time. I'd like to be quick na lang. All right. The fourth response is the abnormal flexion, or ito yung tinatawag natin na decorticate. If the patient shows abnormal flexion accentuated by a painful stimuli, you say you pinch the chest of your patient, and the patient would bring up his arms, he flex his arms up to his chin and his hands are closed. That is what we call decorticate posturing. So what is happening here is that we have this injury that has gone down and impacted. All right. It even started to have maybe an impact at the top parts of our brainstem. And so we're going to start to get these real primitive responses in our patient's motor response. Okay, this is what decorticate looks like. Close hands, arms are abducted and flexed against the chest, legs are internally rotated, the foot of the patient or the feet of the patient is turned inward. Okay, napakadelikado po ito. Alright, na response po ng ating pasyente. So again, moving to the worst response that you can get from your patient aside from no response is the abnormal extension. Ito po yung tinatawag natin na decerebrate. You see, if the patient presents extension or extension accentuated by painful stimuli, you pinch the chest of the patient and your patient would extend his arms, you would give the patient 2 points. So now, among these two, before that, this is what decerebrate looks like. Decorticate with letter C to be mindful of, decerebrate or descent. Okay, you're going to descent your arms, pababa sila lahat, decerebrate. So again, of these two posturing, abnormal posturing that you will see, decerebrate is definitely the worst of these two because it signified that we have got injury further down into that brainstem and really impacting our patient's core primitive functioning. So decerebrate posturing can be seen in patients with large bilateral forebrain lesions. Okay? In the case of a patient that does not present any motor response or reaction, again, 1 point is given to that patient. Sir, tanong, what if a patient is intubated? What if the patient is unconscious? What if the patient is pre-verbal? What is the most important part of this GCS? It is the motor response. That is why it's very important for us to really assess carefully the motor response in the GCS of our patient. Okay, the mnemonic that I can give you here is can't live without fans. Again, sport event. Can't live without fans. Can't obeys commands, live, localized to pain, without, withdraws to pain, or yes, F, flexion abnormal, that is decorticate. A is abnormal extension, decerebrate, and N is no response. So ladies and gentlemen, this is your the table of your Glasgow Coma scale. And yes, the classification of brain injury according to the GCS is severe, is considered to have 3 points, a total of 3 to 8. Moderate, GCS score is 9 to 12. And mild to normal is GCS 13 to 15. Now, very quickly lamang po, the pediatric Glasgow Coma scale is very much the same with the adult. Okay? It is because in the pediatric Glasgow Coma scale, the table is modified. All right? So for a patient who is 1 year more, 1 year older or above 1 year old, you would see the difference. Okay, so if you're going to stimulate, you're going to talk to that patient to verbal command, that is 3 points. However, for 12 months below, you need to shout, not a normal voice, but you need to shout. Okay, in the motor response, higher than 1 year old, they would obey. However, in patients who is 12 months younger, they would be spontaneous. Ganyan lang po. nagkaiba-iba lang po sila with their age bracket. Kaya nga po, ang tawag dito is modified PGCS. Kung merong modified general community quarantine, we also have here modified pediatric Glasgow Coma scale. So yes, once again, ladies and gentlemen, thank you for listening. This is Rafter Manuel. And by the way, if you want to have a copy of this PowerPoint, you may do so. You just give me a message and I will be happy enough to share to you the copy of this PowerPoint. Once again, have a blessed day and a productive day to everyone. Ma'am Sol, ma'am, nakamute ka po.
Hello
Thank you
naman.
po.
Nakamute na naman ako. Thank you very
Yes
much,
po.
Mr. Manuel, for that very comprehensive and very interesting slides that you have prepared for the rest of the class. Kaya lang, you have gone beyond the time. And I think
Sorry
it's
po.
important that we have, it's okay, I think it's important that we have our lunch right now. So we will be
Yes po, ma'am.
continuing on later this afternoon at 12:45 for the rest of the remaining head nurses who will be giving you who will be giving you their presentation. Tatlo na lang po. And then afterwards, we will have your Q&A and then quiz. So we will actually be consuming, maximizing the time for today. This is how you have to understand, you have to make some sacrifices on our part and in your part because we will not be having the time. We will have all of these days for your holidays and we could not sacrifice the content and the discussion at the same time, the things that you need to know prior to your return demonstration. So kung tutuusin parang dalawa tapos there is, sabi nila walang pasok pala bukas guys. It's a charter.
Ay, totoo yun, ma'am?
Yes, I think there is already let me check my email. This is for everyone who
Eh,
are right now. There's proclamation number 113,
hindi
declaring
mo
Saturday,
balita yan, ma'am.
that's March 20, 2021, that's tomorrow, is special non-working holiday or special non-working day in the city of San Fernando, La Union. So, we don't have classes tomorrow. So, ibig sabihin nun,
Yes.
natanggalan na lang tayo. Anong yes? Ang hirap, may hirapan kayong mga head nurses for your evaluation day. So we will maximize our time for today. So konting sacrifice lang everyone because they are all the topics that were discussed by your head nurses and our discussants will be included in your quiz and in your examination. And likewise will also be included in your exam. And I'm talking about prelim exam. Okay, naintindihan po ba? So, kailangan makinig po kayo. Later on, after the Q&A is finished with all of the rest of the head nurse lectures for today, meron po tayong online quiz. And that online quiz will provide me information of all of those people who participated, okay, online. Kapag wala yung pangalan mo, ibig sabihin nun, nag-cut classes ka. You are not around when we have conducted the quiz. So that's your online quiz. By the way, we will be giving extra points or additional points for the top 3 people who can answer the questions correctly. It's a 5-point online quiz, by the way. So please stand by later. We are going to, we are going to go off on air for the meantime, and then we will continue at 12:45. So be guided accordingly. Let's see each other at around 12:45. Thank you very much, Rafter, for that
Thank you,
presentation.
ma'am. Happy lunch
Okay,
po. Yes po,
for
ma'am.
our head nurses, si Mr. Kilon, Mr. Tejero, Miss Tejero, and Miss Ibitoye, I'll be giving you a different link. So check your messages in your messenger. So thank you very much. You can have your lunch break, everyone. Kasi alam ko
Alright,
you
sige po, ma'am.
are
Thank you po.
hungry. So, goodbye, everyone.
Bye po,
Let's
bye po.
attend
Sige,
each
ma'am.
other at 12:45. Thank you.
Noted po, ma'am. Bye po.